All right, good evening, ladies and gentlemen. I'm Chuck Brady, I'm the Chief of Public Affairs here at the VA Southern Nevada Healthcare System, and we'd like to welcome all of you for coming out tonight to our quarterly town hall here at the VA Southern Nevada Healthcare System, which is a joint town hall between us and the Veterans Benefits Administration to try and assist our veterans with any care, services, individual needs they have. But we also use these events to be educational and matters to try and tell you what's going on here with the VA locally, and to give you a kind of a heads up of what we're working on to help you and provide you with better care. So what this is a moderated town hall format. We've been asked in the past, we were asked to kind of, so those of you who haven't probably been here over a year or so to one of our town halls, we do it a little different. It's a moderated town hall. We were asked to come up with a way to get more questions asked and provide more information during our town hall. So what that means is that we have comment cards that you should have been approached or seen comment cards so you came in that you're welcome to put your question on. And then that'll come up here, and it's a kind of a question, it's a general audience type question, something in general that would be of interest to many people here. We'll ask that question and answer it here. We're not going to ask any questions that are personal in nature to you or your individual situation or your personal thing. However, we will take that card back, and if we will get you an answer back on that. If you put your contact information on that card, we will get you an answer back, or it's the proper service to look at that. Also, let you know, we do have some of our different services still outside there for a few more minutes. So if you have an enrollment question, a billing question, a women's health question, those things, we do have some of those services out there. Benefits, obviously, too, is our big partner in this. So we actually have a claims clinic, and we have 2 outreach specialists. They're right in the back there. They want to waiver and Rebecca. With Veterans Benefits side. So if you have a benefits thing that you'd like to look into for your individual situation, one of those 2 can help you out, and they do a great job. So that's what I wanted to give you a heads up on. And then also, just to give you a heads up, we had there's a little card that I think many of you may have gotten off the tables out there. It's has the VA Southern Nevada Healthcare System on the front, but on the back of that card is a list of all of our different social media sites, everything from Facebook to Twitter to Instagram, but the most important one under is our website for the VA Southern Nevada Healthcare System, so that it has some of our different sources of information. What you can do with the website for our site is go on there and actually put your email address in, and then you'll get email whenever we put a new news item up on our website. So when we have events like this, you'll be among the first to get notified that we're having them. So that's just some more of the ground rules and information for that. But before we get started, I just kind of wanted to, before we introduce our panel, I wanted to say hello to some of our key individuals in the audience. Taking care of our veterans is a community partnership. It's a federal partnership too, and with our federal agencies. So I just like our congressional representatives that are in the audience, please just kind of stand up and wave your hands. I'll try and remember you all by name. Hunter King with Congresswoman Vita Titus and back there is Victor Ross with Senator Cortez Masto. Kevin Schmidt is with Congressman Ruben Hewen, and I think Blake Bowles is somewhere around here. Yes, okay, and Blake Bowles with Congressman Jackie Rosen is here as well. So thank you to all. Did I miss any of our congressional reps? No? Okay, great. Well, thank you for all of you being here and for all you do to take care of our veterans too. So on our panel tonight, we have Ms. Peggy Hers, who is the Director and CEO of the VA Southern Nevada Healthcare System. Welcome, ma'am. We have Dr. Ramon Comanduri, who's our Chief of Staff for the VA Healthcare System here in Las Vegas. And then we also have Ms. Kelly Stillman. She's the OIC in charge of the Las Vegas Benefits Office for the Veterans Benefit Administration. I'm sure I botched that title up, but I hope I've got that close. But she's the person in charge of benefits in Las Vegas. So So thank you all for being here. So before we get started, Mr. Kurtz is going to provide a little update on what's going on here at the VA local.
Good evening. Hi, everyone. So we ended the government fiscal year at the end of September, so I have a few little facts and things that I'm going to share with you tonight. So at the end of fiscal year 17, we treated 61,692 unique veterans here. That's an increase of 3.9% from fiscal year 2016. So we continue to grow here. For those who have come to town hall before, we've talked about how we have grown 32% since 2011. So we continue to have people move into the area and veterans coming to see us, and that's a good thing. So we have this beautiful facility, and that's what we want to do is serve veterans. We did 892,000 outpatient visits at our 4 clinics and 2 CBOPs. That was 34,000 more than fiscal year 16. Our average appointment wait times, 92% were average 30 days or less. You can see the numbers for primary care, specialty care, and mental health. We did 37,000, almost 38,000 emergency department visits, which is an increase from 13.6% from fiscal year 16. And our average door to triage is 7 minutes, door to doctor 18 minutes, all within VA standards that we're supposed to meet. We did 5,557 hospital admissions, actually less admissions than last year, because where is healthcare done today? Outpatient. Most everything's done outpatient. So that's not surprising that we went down in our admissions. But we continue to run at about 83% occupancy here. And as soon as you get 85% occupancy, you're really considered full. So we continue to be full. We continue to have at least, on average, about 50 veterans in the community hospitals every day, besides the 80-some we have in here. So we do share with the community with that. And we answered more than 1.2 million calls. So when you can't get through, it kind of explains it's a lot of calls coming in here. But we've been trying to add more staff to take phone calls. So those are our stats kind of ending up for fiscal year 17. But what I wanted to share with you tonight is the Secretary of VA, Secretary Shulman. He is the physician. His top 5 priorities for us for this year. Number 1 is greater choice. And so that is about getting care and partnering with the community to get care in the community. There are certain things that we don't provide here. We don't do transplants, we don't do certain cardiac surgeries. We buy those services for veterans out in the community. So he wants us to look at more of how we can partner with the community and provide services within the community. His second goal is modernizing systems. And we have a computer system right now in the VA that is 35 years old. And so in, it was this summer sometime, or June-ish, I think, he signed that we're going to get a new computer system. It's called Cerner, and it's the same system that DoD bought. So that we'll be able to hopefully partner with DoD. So this is going to be a long process to get a new computer system. Long, up to 10 years it will take to switch all 142 sites and over 1,000 clinics to this new system. We don't know when we'll see it here in Las Vegas. We've been told that VA is going to follow where DoD puts it in, so that we can learn from what they're doing, and then we would do those hospitals first. So right now they started up in Bellevue, Washington, and probably where we'd start is in Seattle when we get ready. This contract has not been signed quite yet, but we do know that's the company we're going with. Also looking at a lot of modernization of systems as far as centralizing things, centralizing more HR functions, centralizing contracting, centralizing even call centers. We're looking at having more centralized call centers across the country. His third goal is focused resources. So that is looking at how we can focus towards our mission. And Secretary Shulman has told us our mission is primary care and mental health. and prosthetics and spinal cord. So those are our big missions, so that's where we have to focus our resources on. So as we hire people, we're looking to hire people in primary care, mental health, prosthetics, that's where we're focusing our resources. Now, does that mean that we don't focus on hospital? No. We continue to do what we do at the hospital, but as far as the kind of care that we can be good at is focuses on primary care. The fourth thing is improving timeliness, and that is about getting appointments as fast as you can. We live in a very difficult community to find healthcare. This valley is how many doctors short by today?
Thousands.
Yeah, at least 1,000 primary care doctors short of what we need for the population that's here. So that creates quite a challenge for us to try to get and retain primary care physicians, because the competition is huge. We have actually lost physicians, places in town where they paid all their medical school debt off and gave them a shady lease. Okay, this is what we're up against. We're the government. We cannot pay any more than what the president makes, so that makes it a little difficult for us to recruit and retain. So we continue to work on that. We've been very fortunate recently to make some hires, and we're starting to see our access time really come down. So we continue to work that. The hard part is specialty care. So that's your specialists that do pulmonary, cardio, orthopedics, hand surgeons. Very difficult to find a hand surgeon appointment here in Las Vegas. So we look at where we can send people, and we do partner with other VAs if they're able to offer those services to us. But they're like us. Well, they're not growing as much as we are, but there's a lot of demand as baby. All those things, the demand is huge. So we continue to work on that. And then our fifth thing is suicide prevention. And that is our big goal for this year. And I'm going to talk a little bit more about that right now. So all of us can be involved in suicide prevention. All of us. And approximately 20 veterans are dying every day across the nation. And out of that 20, only 6 use VA services, and 14 are not receiving. So what we're really going to be focusing on this year is getting our community partners to work with us to find these veterans. And we can't do it all ourselves. It's kind of like homelessness. When we started working on homelessness about 5 years ago, how do we get the whole community to help us find homes for our veterans? And we're going to do the same thing with suicide prevention. And we are working with our Community Veteran Engagement Board, and I guess Nina wasn't able to stay, but our chair of our Community Veteran Engagement Board was here tonight. And we're working with that group on how we can get the message out to everybody. So all we all need to be able to do is, you have to be willing to listen and be willing to ask if a veteran has any thoughts of suicide. And that can happen anywhere. And we tell our employees that can happen while they're checking in for an appointment. It can happen during their appointment. It can have to be overheard in the canteen. It can be overheard anywhere. And we all need to be prepared to step in and offer them assistance, or at least point them to where they can get that assistance. And so I encourage all of you to take that phone number right there, the Veterans Crisis Line, put it in your contacts in your phone. Because you never know where, when you're out in the community, that you might meet somebody that you need to give them this number, and right away. So I encourage you to put that in there. Way, it's 1-800-273-8255. Option 1 is for veterans. That is the national crisis line for everybody, but option 1 is for veterans. So here are some potential signs of suicide. Performing poorly at work or school, acting recklessly or engaging in reckless behaviors, sometimes without thinking, showing violent behavior, such as punching holes in walls, getting into fights, being self-destructive in general, and looking as though one has a death wish, tempting fate by taking risks in a car or whatever. Those are all things that could be symptoms of suicide. So when somebody says they're going to kill themselves, we need to take it seriously. because it can be a cry for help, right? It can definitely tell us about that. Another sign, giving away prized possessions, putting their affairs in order, and seeking to access firearms, pills, or other means of harming themselves. So we all just need to be aware of those things so we can help whenever we can. And as I think it was President Clinton said, it takes a village. And it's going to take a village just like it does for homelessness to help with the suicide issue among veterans. And I know Bobby sent me an article today about suicide in women veterans and the increase that's happened with that. So that's another area that really needs attention. I did want to go quickly over some upcoming events that are happening. On November 1, we'll be having an open house here at the Medical Center from 10 to 2. It'll be similar to what we had out here, different booths to learn about different programs we have. VBA will be there, some of our veterans groups will be there to offer things. And that'll be a short little time frame that we'll have. I think we're going to have it right out here. So if you're in having care that day, stop by. There'll be things to learn that day. On Veterans Day, we have the free barbecue and car show. It's going to be right out here. Okay. And that's really a fun event. We have entertainment. We have booths of different organizations that come and talk about what, have booths of information about what they offer. On November 11th is the Las Vegas Veterans Day Parade. We will have a car. Actually, we'll have the vet center here. We have new, probably outside. The vet center now has their own mobile van. After the October 1 shooting, we did not have a vet center van here in Las Vegas. And as a result, we now have a vet center van here in Las Vegas. So that's kind of something good that came out of something very bad. And then November 11 and 12 is the Aviation Air Show at Nelson. So there is a lot going on in that week of at the start of November. So we hope that you take advantage of the different activities that we have going on. All right. Kelly, do you have some?
Did you put that 800 number back?
Oh, I'm sorry, sure. There you go.
In fiscal year 2017, VBA in Nevada broke a record by processing over 12,000 claims for rating cases, which is a 15% increase over what we did last year, around 10,000. VBA in general broke records in all sorts of benefits. Life insurance, we provided 1.2 trillion in coverage for service members, veterans, and families. Vocational rehabilitation and employment assisted over 15.5 thousand veterans achieve positive outcome, get jobs. Pension and fiduciary paid over 5.7 billion in pension benefits to over 491,000 beneficiaries. We paid 79 billion in post 9/11 GI bills to over 1.8 million individuals. We paid 78.2 billion to nearly 4.9 million beneficiaries in compensation benefits. Home loans, we did 2.89 million. And benefits assistance, we did over 6.7 million registered e-benefits users, which is nearly 1 million more than we did in 2016. So we had a really great year. We're expecting 2018 to be even better. We also have the same priorities that Director Kearns had discussed earlier. And for greater choice, we're doing the appeals reform and modernization and the Forever GI Bill. We're modernizing systems by creating auto establishment of claims and updating the regulations for disabilities. We're focusing resources by extracting paper from all the offices. In the past years, we've become paperless upfront, but we still had files from past claims that were in filings. We actually emptied our file in August up in Reno, and we are completely paperless, which is really increases our processing time. And then improving timeliness, we've got the national work queue for all claims. We started decision-ready claims, improvements to the national call centers, dependency claims processing is improved, and we've instituted new performance standards for our employees to increase their processing time. And then, of course, suicide prevention, which we're involved in the same initiatives as the hospital. So we're really looking forward to 2018 and breaking more records for the state of Nevada.
Great, thanks, Kelly.
Yeah, hi. Good evening. Thanks so much for everybody for coming out. Just wanted to add a few things that we're doing just in the clinical side and where we're headed. Some of the positive things that are coming forward, as Ms. Burns talked about, we've hired some additional staff. Last several weeks, we have been really taking an aggressive approach to hiring additional mental health staff. And good news is we've been able to recruit some folks, and they're slowly coming on board. So the good news is we were already growing in that area. We have a tremendous need for mental health services, and we're hiring them. And in both medical and mental health services, Nevada ranks 49th or 50th in the nation. So we really don't have the resources in the community. I can tell you, in many areas, we're well below half the number of healthcare professionals needed in this community versus the rest of the nation. So we would have almost double to get to the average of the nation. So that tells you how difficult it is within our community, and obviously that creates our challenges. Some of the other things that we've been able to hire, which recently we've got a new ear, nose, and throat surgeon we just hired. So we will now have 2 ENT surgeons, and there's a tremendous need for that. So that's a positive thing. We've hired a thoracic surgeon. She's on board, and we'll be able to do lung cases and do a lot of more complex thoracic surgery, very positive. We've hired a new nurse practitioner in our dermatology clinic, so that will provide additional derm access. We've added 3 primary care teams here at the medical centers, which is very positive for veterans to get primary care at this medical center, which is a certain new thing to add. The other thing I wanted to say is that we're going to move increasingly to healthcare to where veterans live at their homes, right? So more and more we're doing medicine through telemedicine or telehealth. So we're implementing a couple of things within the VA. One, we have signed up to get into what's called a telestroke program. We already have a neurologist who provides consultations to other VAs on how to manage a stroke. Somebody comes in with stroke. With stroke, we always say time is brain. So we want to be able to, as quickly as we can, treat strokes. So it's just like we talk about a heart attack. This is we call a brain attack. So stroke is something we have to deal seriously. And we're beginning to work on that, is to make that more aggressively address the stroke case. So part of that, we've signed up LEICU, an intensive care unit program. Again, through telemedicine, we partner with other VAs. Another positive step. And you're going to see more and more telehealth delivered directly to the veterans home, and we're working on ways to get to that. Just a couple of folks I want to introduce, just so you know. Dr. Strawn, Dr. Strawn is our nurse executive at PCS, is here in the back, so she's here joining us here. And then Dr. Robinson Mayer is sitting in the back, and you can stand up away. She's in charge of both our Southwest and Southeast primary care clinics, so she's done a tremendous job in those areas. So if you have questions, certainly should be around. We'll all be here to take questions later. Thank you.
About Video Connect?
Yeah.
Right, that's the newest technology.
Yeah, that's a Televideo Connect is a new mechanism, and actually we're trying to dramatically increase the amount of services. So it really essentially, from your desktop, from the physician desktop, you can directly connect with the patient and be able to, and through an app, to be able to talk to the patient. So it's another new mechanism that the VA's just introduced.
I want to just tell the story. Hi, everybody. This is really slick technology, this Video Connect, and I see it as one of the ways, instead of getting a phone call from your nurse after you have a procedure, she can like put eyeballs on you through one of your apps through the phone. So for what we did a couple of weeks ago is we had a veteran who was here, and his surgeon was in LA, VA, and his daughter was up in Seattle. And so we used this new Video Connect technology, so the daughter was able to hear and see her father in your plan of care. And we are all able to do that and are all in different remote locations. So the potential here is endless. And so we will continue to move that forward and we'll see it in a lot of different applications. So thank you.
Thanks, Dr. Strong. Dr. Strong is also our nurse executive, so. All right, I guess we'll get started with the moderated Q&A session. So like I said, if you do have a question, you have to put it on a card yet, you're welcome to do so. The cards are back there. And one of our public affairs people, Mr. Dave Martinez, is in the back there. He'll get that up there to us. So I'm going to start with the VBA this evening. So Kelly, this one's going to you. We have one question with a follow-on here. Kelly, can you provide an update on what's currently going on with the appeals modernization process? According to some of our vendors, they keep hearing a lot on it, but they're not sure what it is or what's going on with it. It seems like a lot of questions that we keep getting a lot of our outreach in it. So could you explain that a little bit?
Definitely. So the new law was signed on August 23rd, and they gave VBA 90 days to come up with a plan for implementation. So that's due in November 2017. The framework will be implemented in 18 months, so that's not until February 2019, but we're launching the Rapid Appeals Modernization Program, or RAM. So it will allow eligible veterans with currently pending appeals to opt into the new process. And it provides early access to all advantages of the new process, protecting effective dates, protecting findings, early resolution options, and improved decisions. So we're about to roll that out within the next few months, and there will probably be a lot more information coming to you. But if you want to know specifically about the different lanes that are created by this new process, there's handouts on our benefits table right outside the door that you could take, and it kind of has a graph for which lane you choose, what will happen.
Okay, great. Now, kind of follow on with that, that's the appeals part of it. But the other part of this that the VBA is doing, they have a new program called Decision Ready Claims. And we know that was just kind of started last quarterly town hall we were here. And Ms. Jackson said there were probably more to come. But, and I don't think any vendors had taken advantage of that as of yet, is what she had said the last town hall. Can you explain the Decision Ready Claim process?
Yes, so the point of the decision ready claim is to improve timeliness, one of the Secretary's priorities. And it's supposed to have veterans get decisions within 30 days of submitting the claim. How to get involved in that process is you need to work with your service officers, and they will help you gather all the evidence that you need to submit the claim, so it's basically ready for a decision as soon as you submit it to us. So nationally, they're seeing results in about 90 days. But as Chuck mentioned, we haven't received any in Nevada yet, so there is some limitations. It's only on claims for increase. So it's a claim where you're already service connected, but your condition is worsened. So we don't have to go through the gathering all the records. You just submit the claim, and it should be ready for decision as soon as we get it. So it's a really awesome process. I'm really excited to see what we can do with that in Nevada. And we just need, I think, to get the word out to veterans that this process is available.
Okay, great, Kelly. I'm going to throw in a final one here that came in from the audience tonight too. As part of that, since we're talking about claims and how you fill those out. The question is, what's the process for getting a disability added to an ongoing claim? What options do I have if I want to utilize my educational benefits? I'll ask that later. Let's talk about claim one first. On the disability, how do you get that added?
So there's multiple ways you can submit a claim with papers or intake. You just do the same thing that you did to submit the claim initially. Fill out a VA form 21-526. You can do it through eBenefits. You can see one of our claims examiners here tonight. They can take your claim with you right now. So the same thing that you did before. If you have a current pending claim and you need to add additional disabilities, you can do that at any time during the next process.
All right, great. Thanks, Kelly. I'm going to ask a VHA question now, and for whatever reason, I think a second part that probably fits to a better question here that I'll ask with you. And this is a VHA question. We keep hearing a lot in the news about, and Secretary Shulman was on the Hill this week testifying about the next generation care in the community program that's going to be rolled out here potentially in the future. You know, Congress, the Senate has their own version, the House has their own version, the VA has its own version, and all have to roll into something at some point. But can you talk briefly about, you know, some of the changes that are currently being made or being proposed to be changed, and how this will affect our patients here locally, and will we be losing any services here at the hospital with this new program that's coming out?
But we won't be losing any services here at the hospital. Our problem, as we've said before in this community, is finding the services. But what's going to change in the choice program, most likely, because it's not been signed or anything yet, but the 40-mile and 30-day requirement will go away. And what we've been told is that it will be replaced with a system that kind of, I don't want to say ranks, but looks at each facility and the quality and your access and your timeliness and all those, puts that all together in a rating, and then it'll be decided, do you offer people to go out, or do they stay in? So this is all kind of just being talked about right now because the law has not been signed yet. But we do know that we will be taking back in-house making the appointments for outside care. Right now, the veteran has to call a third-party administrator to TriWest. And sometimes things get really balled up there. So we'll be taking that job back into the VA to make those appointments. We've had to hire quite a few more people to get ready to do that. At the same time, we will hire a company as part of this law or bill, or we'll hire a company to develop a network for us. So if you've ever had Blue Cross or United Healthcare or Aetna, they all have a network of physicians that take that insurance and work with that company. What we're going to have is a company that will set that up for us, so that we have doctors that provide care to veterans that will have to meet certain quality indicators, and they'll become like trusted partners that we can send our veterans out to. So those are the changes that we know right now, but we're not going to lose any services here at this point. We have a great advantage in all these changes that are happening, is that we have a beautiful new facility. We are fortunate with that, because some of the things they're going to have to look at nationally is how many VA hospitals do we need, how many clinics do we need, and that evaluation is going to be going on over this next year, where they're going to come into each of our facilities and evaluate what kind of care we give, what we should be giving, and how we can partner with the community. So that will happen over this next year. The interesting thing about Las Vegas is we're kind of an island unto ourselves. We kind of sit out here in the desert, and nobody's very near us. Our vision, our network that we're part of, is up in Northern California, way too far away from us. Southern California is 4.5 hours away, so you know, we're kind of like our own little entity here. So I think we'll see some changes over the next year. Hopefully, they're going to be for the better, but I don't have all the details as to how those will change.
I was gonna just add also, this community is lacking so many services that many things that are standard in a community of our size, over a couple million people, don't exist here. A good example, if you need a heart transplant, nowhere in Nevada can you get that. If you need a liver transplant, you would have to leave the state. So if you need bone marrow transplant, again, you'd have to leave the state. Whether you're with the VA or any organization, there is nowhere within the state is that resource available. So some areas you have to come to coordinate work. So no matter what the choice program is, we can look for things locally, but some are just not even available in this state, which is really kind of unheard of. Most states, they have all these services.
Great, thanks, Dr. Connery. All right, so we have a couple questions that came in related to the caregiver support program. And just to kind of sum them up, it was kind of in two areas here. The veterans were kind of asking, you know, why everyone was being reevaluated on the caregiver support program. And if a veteran sees a change in their status, or what can they do for their, so their caregiver stipend isn't changed, or if they want to appeal that to.
I'm gonna have Jennifer answer this, because that falls under her area.
So the caregiver support is actually, the program is actually requires for people to be reassessed at different points in time. And so we had found that we were not quite adhering to the handbook, and so we made a significant effort to go through and make sure that every person who is receiving the caregiver support benefits were at the appropriate tier, appropriate level. This is something that, this is a program where we want people to get better, we want them to progress. And so it's something that you do get evaluated on. And then there's a second part of the.
It was kind of what can they do to appeal?
So there is an appeals process, thank you. And so you can appeal here locally. And if you are wanting to do that, then we can have you put a complaint in or file a request through the patient advocate office, and then that's the trigger that will start the clinical appeals process. So if you provided your information on the card that Chuck has, I can give it to our patient advocates tomorrow and initiate the clinical appeals.
Thanks, Dr. Shaw. All right, this one is kind of like a joint Veterans Health and Veterans Benefits question. This is one we received via email. And the question is, when is Veterans Health and Veterans Benefits Comp and Pension going to implement the evaluation and testing procedures being used in the sports environment? They are able to determine how many concussions a person has had and what coordination problems a person might have, and they have more therapies available. So I guess the question is, and the individual was, I believe it was there was a two-part question I sent directly to the VA on TBI-related injuries. So I think that this individual was asking if there's a sports protocol that might be looked at to look at TBI.
I don't know about that specifically, but in general, VBA is looking at all of their rating schedule to revise them and revamp it to come up to date with modern medicine and make sure we're getting proper evaluations with what we've learned about PTSD, TBI, and everything in the past few years. So I'm not sure that that's specifically being looked at, but in general, our entire rating schedule is being revised, which it hasn't been done in like 50 years. So hopefully they'll look into that sort of thing. I'm not an expert in that field, but it sounds like with all the modern medicine, that would be something they would consider.
And again, TBI is obviously a very complex illness. When we see it, it's also in combination with post-traumatic stress disorder. So you have both cognitive impairments, emotional connections. So you have a lot of these linked together. The challenge is the treatment. It isn't, unfortunately, when we see somebody have it, it's not like it's easily reversible because there is the belief is that the neurons are sheared during this point, so the damage is significant now somebody's impacted. So we need to look at all of the steps that are needed now. Some people have mild and can do well, others are much more severe, where they're almost not able to recognize their own family members. I've seen the full range of traumatic brain injury. And even the ones with mild have frequent significant headaches and other pain. So we have to use pain treatment. We have to be able to use also the different emotional types of treatments to help folks. Not a simple, easy approach to it, but both our pain clinic, our mental health clinic, and also using some of the complementary treatments we're helping veterans with the TBI.
Thanks, Dr. King. And Kelly, this is a kind of a follow-up where you kind of talked about the ratings disabilities being looked at and updated and briefly explained the purpose for that. Obviously, we're in the 21st century now, something that's 50 years old probably does need some updating. But if there are veterans out there who currently have applications for appeals in the system, when you guys finish this ratings disability update, will that affect anything that's currently in the system or in progress?
I haven't received guidance on that. I doubt there will be a re-adjudication. I'm guessing when it's finished, people will have to come in and file with me. But I don't think we're even close to making those sort of decisions yet, so, I'll keep my eye on that, and if I have more information, hopefully I'll be able to share it in the next one.
Okay, great, thanks, Kelly. All right, this question is, came in from the audience here tonight too, is, are there any programs to help veterans learn how to do artwork and play instruments or any type of hobbies to keep veterans busy that can't work or hold a job due to a disability? Dr. King, you want to take that?
Yeah, that's a really good point, because it isn't, what the things we talk about, one of the things we discussed is a good example is what's called supported employment. It's how do we work, and it's a program we're looking at how we can get started here too at this VA. The question is like, perfect, I'll give you a good example of a supported employment program. You have a veteran who is service connected. Possibly I have a good example of a veteran I knew of, 100% disabled, developed a serious mental illness while in the military. He's 100% service connected. So he's getting a check every month, he's financially secure in that sense, he has housing, he's stable. But he says, look, I've got nothing to do, I'm not linked, connected. So, what does it do? There's a couple of things. A form of employment, one, gives you a sense of purpose. There is a purpose for it. Second is it connects you back into society. So what our goal, and we're looking at in mental health to build a supported employment program, is we work with private agencies to say, this veteran, we're not worried about their financial health, we're not worried about their housing, all of those basic needs are taken care of. But they will come and work at your agency for 2 hours on Saturday to help you. So intermittent will come, just so they're also linked and supported. So there are several approaches to that. That's one way to get folks, now that they take care of, is the ways to manage. The other ways to address these things, we have veterans that come into some of the programs that we have here. One, we have a Tai Chi program, that's an example. We have a yoga program. We have folks that come in for these additional services that are just beyond normal maintenance, but really to improve your health. So there are things that you can do, but certainly hobbies, get people engaged is the most important thing. And whatever hobby, things that they like to do, which now increasingly many of our younger veterans like the electronic games, and they're linked in that way. Now, interestingly, you can also socialize through these games. I didn't know that, but what happens is many of these electronic games that I've seen plenty of younger veterans play, they're actually linked worldwide. They're playing live with other people all over the planet. So they're in fact socially engaging with them, even though we think, well, let's just sit in front of a computer game or something like that. In fact, they're also engaging. So whatever links to that person is important. But I think if we can get a supported employment program, that would be an excellent opportunity for us.
Great, thanks, Dr. King. Kelly, I'm going to throw another one to you here. Congress recently passed the Forever GI Bill. What additional benefits does this provide to our veterans? And is there a specific date that you had to be on active duty to receive the Forever benefits?
So the bill is not retroactive to people who already use the bill, but what it does is it gives a lifetime benefit and it does away with the 15-year limit. It restores entitlement and provides relief to those affected by school closures. It provides full post-9/11 GI benefits to any Purple Heart recipients. It includes high scholarship into the eligibility program, expands eligibility to National Guard and Reserve members, makes changes to the transferability to spouses or children upon the death of the originally designated recipient, and authorizes $30 million for automation of education original claims and renewing supplemental claims.
Okay, great. And then we kind of had a question that came in here, and I think probably it's best if the person probably just doesn't speak. This sounds like it would be an individual situation. The person was asking about what options they might have to use their educational benefits, and they separated from the service back in 1996. Would you just recommend that maybe they talk to a benefits counselor about their options?
Yeah, it's so situation specific that it would be best if you saw one of our claims processors here. Is that person in the room? Rebecca can probably take you back into somebody.
Yeah, no, we don't help you out. All right, this one's more of a, I think, an observation than a question. And it kind of gets at the generations of veterans that we serve everywhere. We have 100-plus-year-old veterans that come to this facility. Some for the first time, down to some 20-year-old veterans. So I think this gets to a generational thing and looking across the spectrum. But the comment is kind of like says, we need more printed materials for that veterans that don't have access to computers, such as benefits information, financial classes, training. This appears to have been an eliminated service for veterans who are over 80 years old because they are not computer savvy. Just as we talk about benefits side, Kelly, I think we can address the VHA side of what we do as far as having printed materials for people who aren't computer savvy.
So in our lobby here, we keep printed material for anybody to take at any time, and that's part of our outreach initiative is to reach people who can't be reached. So we have 4 outreach specialists in the state of Nevada, 2 here in Las Vegas, and I'm telling you, those are the hardest working employees I have. They are at events 7 days a week. They work 10 to 12-hour days. I don't know if I could do it if I were them, but they've got printed material for anybody to take, and that's the best option. But they try to be at every veteran hosted event, and anywhere where they think their veterans might be, they're invited by members of the community, several that I see here. We gotta, as a community, we have to help get that information to veterans who don't have that access.
I'd say also on our side, we,
I'm the guy that asked the question. I don't think you all realize if everything goes on the computer. I was told by representative last week that the VA was going totally computer, there'd be no more printed material of any kind except on the computer. So you've got several million veterans out there who are not computer savvy or have access to computers. So what are you going to do with those guys?
I think what they meant by that is we process claims paperlessly. So my employees don't have printed paper like they used to. So it speeds up the claims process. That doesn't mean that we don't have paper resources available.
Well, I've had guys, I'm vice president of Korean veterans here. Both ways. I came out to get information for them. And one of your representatives told me, I have nothing to give you. And his comment was, they could go to a library or something and access a computer. The point is, they have no computer savvy whatsoever. So going to a library, not a computer, that doesn't answer the question.
Afterwards, maybe we can talk and we can set up, have somebody from my office come up and give a presentation to your people and bring materials.
I'll give you a card.
Great.
Or maybe you could get information like that to other, like the American Legion, the VFW, and let us pass out this information and answer some of these guys' questions. There's several chapters of all the different associations here in town. Get some information to them. Rather than somebody having to come all the way out to the hospital to try and get it. Okay? Thank you.
Thanks, sir. And then on our side, if the veteran does need some assistance, with intake or, filling out paperwork, our customer service people will be happy to assist them with that as well. And we'll take that for action. We'll talk to our veteran services organization. We meet with them about once a month. We'll actually ask them what they're doing or how they'd like to receive that information and make sure that they're helping get that passed along as well. So, thank you, sir. Right, this one's a veterans health question. And the question is what is the future for the cardiology department at the Las Vegas hospital? And apparently the question was the person said that they were kind of refused surgery by an anesthesiologist who explained there's no cardiac support here in our hospital. Is there a plan to grow our cardiac care in our hospital? I know we talked about the care community option.
Talk about, we do have cardiac care here. We have a stellar cardiac cath department. Our chief of cardiology, Dr. Tillman. Dr. Tillman Cyrus is an amazing cardiologist. He's done a unique approach to the arm instead of the groin for his cardiac caths. It's considered really novel. He's European. In Europe, they do this. People locally, doctors locally ask me if he can train them to do his technique. So we do that level of cardiac care. We have cardiac caths. What we don't have is cardiothoracic surgery at this VA. VA has different layers of complexity. They go from, there's like 5 layers. Level 1, A, B, and C to level 2, level 3. We have been upgraded from a level 1C to a level 1B, which does allow us to do more complex cases. Usually level 1A, which tend to be very highly academically university affiliated places, are the ones that do cardiothoracic surgery. The challenge here of getting to that CT surgery here, we have to have the medical school grow bigger and build a strong academic department. That way together we partner and build a cardiothoracic surgery. Until we build that, we still have to rely on the community hospitals to provide the CT surgery care. Now, what's important also with CT surgery, in fact, just recently Consumer Reports actually did an article talking about where should you get your chest open? If they're going to crack your chest open, where should you go? And one of the main things they wanted you to know is the number of CT surgeries have actually declined because there's less need. And part of it is the drugs that we're using are better. We have lots of statins, a lot of people take drugs to control their cholesterol, their lipids. People are controlling hypertension a little more. So because we're controlling this, we're seeing less so. And we have a lot of procedures done by cardiologists. So a lot of the procedures that we need, when you have CT surgeons, crack open just to do this. So what they found in Consumer Reports really is, which makes sense, is you go to a place that does a high volume of cases. So you don't want to end up being a CT surgeon who says, I do 1 case a month. That's not the surgeon you want. You want somebody who does a lot of cases in time. In fact, just the other night, I had dinner with a couple of my colleagues who are husband and wife for both cardiothoracic surgeons. And in fact, tragedy on November 1, Dr. Quinfight, she ran into the hospital instantly and operated the rest of the day nonstop as a CT surgeon, very competent. Now that's the surgeon that I want to operate, somebody who does that many cases on a regular basis, not a case once in a while. So that's why for us to build that, we don't have a big enough volume right away yet, but in the future as we go bigger, we can add more revenue to the system, and as the university builds, I mean, that's a program we look at building.
Great, thanks, Dr. Conker. Ms. Kearns, just one of the questions we got here was just kind of asking us, what are some of the things that the VA is doing? What are some upcoming things that the VA is doing to better help our veterans here at the facility?
Well, we've got quite a few things that are going to happen in this next year that we're starting now. I think, Jennifer, would you like to talk about a couple of things that we're going to be starting?
Sure. So a couple things that we're going to be starting. There's a program called the Red Coat Ambassador Program. So there's a program called the Red Coat Ambassador Program. Basically, kind of what that is people with a red coat. I think red coat vest here, but they're going to be the people instead of, if you need to get from point A to point B, instead of somebody saying, go down that hall, take a left, take a right, take a left, go through this door, they're going to take you. And as they're walking with you or they're taking you, they're going to talk to you and get some feedback. And if you have concerns or questions or compliments or things you want to change, they're going to hear that information and they're going to direct it to us in the VA and make some changes. We're also looking into doing some secret shopper programs. I'm not going to tell you who's going to do that, but we're going to be doing those. Kind of like in stores to get feedback on, how was your care, how easy was it to get care, things like that. We actually have implemented a standardized phone greeting, and we are right now doing quality control checks on that. So I guarantee you can call my office. The way that it'll be answered is VA Southern Nevada Healthcare System Veterans Experiences Jennifer, how can we help you? And we kind of want to implement that across the board. One of the things I actually asked our veteran and experienced group at our last meeting, I asked them to each go out back to their services and ask, talk to 5 of their coworkers and ask 5 of their coworkers to come up with a standardized greeting when a veteran comes to the door. Good afternoon, good morning, and then tell those 5 more people. So we just want to get to the point where we're actually communicating better with our veterans and things like that. So be on the lookout for the red coats and the red vests, call and get our standardized phone greeting. And if somebody doesn't answer the phone like that, you can tell them that, you know, they didn't do it the right way.
Great, thanks, Jennifer. So we got 2 items left here, and we'll get through them real quick. One is I'm just going to answer it myself for this person, and then we'll wrap up with one final one here. The question was who I could talk to if they were rental property discriminated against me, or what would my rights be if I could, who could represent me? Kind of that's a 2-part question here. I would say if you're under like our HUD Bash program, or you know, we're assisting you with housing, I would talk to our housing HUD Bash program about that, or our CRRC. If this is a general question, what I would do is talk to one of those congressional representatives that was here this evening. They can work with you in the various agencies that are out there, such as HUD and some of those other elements, to help you with a complaint and to help you file a congressional with that. So that's what you can do for that one. Just kind of the final one here. We talked about the importance of suicide and suicide prevention and resources that are available. And kind of this one question I want to kind of put the caveat out there that Ms. Kearns put in here, that 14 of the 20 veterans estimated veterans that take their lives daily are not connected to the VA services and care. But the question is kind of, what is the VA doing to discover the reasons why veterans are taking their lives and working in that? Can you talk about that? I'm very.
Yeah, really, the VA is taking a lot of different approaches to this. First of all, how do we connect with the 14 that don't connect to the VA? And there are many reasons. Is it possible some of them are not eligible for VA care or didn't know they're eligible for VA care? How do we connect with these veterans that they can come to the VA? We have many veterans who knew they were eligible or didn't know they were eligible, didn't come to the VA. So how do we connect with those folks? But we really want to create the general community education of everyone. It's everybody's business to prevent suicides. And suicide really is an epidemic in the United States. We're seeing it all over, not just in the veteran population, but in the general population. In the veteran population, it's higher, as we've talked about. Women veterans, it's 2.5 times higher than the general female population. So why is that? What are the factors behind it? The VA is doing a lot of different research to find out what are the dynamics that leads people to not feel connected, not have somebody that they can reach out to, that's leading to this this reason for suicide. We know we have higher rates of post-traumatic stress disorder among veterans. That certainly mental illness or mental health issues can play a big role in having somebody kill themselves, right? The other thing is, many of our veterans have access to weapons, easy access to weapons. And that's another important thing is we need to do more gun safety and get veterans have gun laws, to have something to be able to say, let's lock it and think about it. If you had a lock, you might think twice before you pull the trigger. So what can we do to have some safe mechanism? In fact, one of the novel things that the VA and also a lot of communities are doing, they're in fact going to gun ranges and saying, we're giving away locks free of charge. So you can at least protect these guns, but also protect yourself possibly from making an impulsive decision. So there are ways we need to use to address the way to deal with the means, so somebody can think twice before they do that. Provide them resources that they can reach out into something so that they're not going to make that decision. And the third thing really is we need to carefully watch the risks of substance abuse. It's a huge, huge problem. Many instances we see these behaviors with people while they're influenced with alcohol or other substances. So that's another thing to keep that in mind when you see people with these issues. They're more likely to engage in this behavior.
One thing I wanted to add to that is, for our gentleman in the front row here was asking about people and resources. We have now 5 suicide prevention coordinators. They are available to go out and talk to any group that wants to have them come out. So if you're interested in having that, let us know, and we'll get them scheduled to come talk to your group.
Outstanding, thank you. So that concludes our Q&A session at the town hall and this evening's event. But we'd like to thank you all for coming. If we didn't answer your question up here, it's because it was probably more of a personal nature than a public nature, and we will work to get you an answer back to your question via if you left your contact information here with us. So just wanted to thank you for coming out tonight. Obviously, we gave you a copy of our veterans newsletter, which we're putting out quarterly. It kind of has news and information on important things that are going on. It also includes our social media sites. There's also a card there for our social media sites. So I encourage you all to sign up for the email so you can get regular updates in that. And then just kind of on a final note, so we're trying to tell all our veterans to get your flu shot. So we have flu shots available in all of our primary care clinics daily between 8 and 3:30. And here at the hospital, they're actually in our employee health section daily. And then if you don't want to go to a VA facility, you can go to any Walgreens as well. And if you're an enrolled veteran, you have to be an enrolled veteran and within healthcare, and they will get you your flu shot at any Walgreens as well. So please get your flu shot if you can, and thank you for joining us tonight.